So, breastfeeding, Libby, I know from personal experience that breastfeeding, and from having a lot of friends who have had babies and breastfed and gone through that whole journey, that it comes naturally for some. For some, it's a little bit more challenging, and everywhere in between. And I think, regardless, at the beginning, you're learning, the baby's learning, so it is a tricky time. It's a beautiful time, but it's a tricky time, and it can be quite hard. And so I just thought, did you want to give a bit of an intro on breastfeeding and what you'd say to all these new mums?
Yes, and so good evening, everybody. Yes, you nailed it, Amelia. It is a very big learning time. This breastfeeding is certainly a journey for both mum and the baby. It is a natural thing, but for a mum to get to know her baby and what they want, and for a baby, to fit with the mother, sometimes there's little things in between that it don't happen perfectly, and sometimes women need to work a little bit hard at the beginning. Maybe the baby has a very small mouth and the mum has a bigger nipple, and that's one challenge that can happen. Lots for people to learn. And I think one of the things also is the different information that you often get in those first couple of days when you're just wanting to get all the information. Sometimes that can be a bit disruptive, but it is a lovely thing to be able to do, and there's lots of help out there of people that are very keen to make sure it's as easy as possible. It is such a journey, and as I said, from friends who've done it and stuff, it's everyone you talk to has a different type of they've had a different journey, but kind of the same in the same way, but different experiences, or one person might have a challenge with something but it's fine on the other side of things. So talking about that, this is our newborn sleep support group. So a lot of the mums that we're talking to are either they could have a baby who's a couple of days old, they could have a baby that's 6-8 weeks old, and I know that there are some pregnant mums in here who are due to have their baby probably very soon. So so a lot of these mums have already have been on this journey or might be in the middle of starting the journey. So do you have talking about the mums that are just about to start the journey, there's some questions about breastfeeding that have come through around during a C-section recovery, and if you've got any tips on that sort of thing. And so some women, if they know that they're having, I don't know, if some of you out there might know that you are having a booked caesarean section, and it's nowadays when people have a caesarean section, we very much get the baby skin to skin as soon as we can. Once baby's born and been checked, and we put it on mum's chest as much as we can, and that's a very important thing to do, even with caesarean section. People talk about there's a delay. If you know there's a delay in the milk coming in if you have a caesarean section, and we're not talking days or anything like that. It might be different. When you go into labour, your breasts get the message from hormones that they will need to be producing milk soon. And that's very much if you end up having a caesarean section. But if you know that you're having a booked caesarean section, the delay is only a couple of hours. I mean, once the placenta comes out, it's all go for your breast. They know that they need to get going. But recovering from a caesarean section, of course, the first 12 hours you'll be lying in bed and feeding in bed, which may not be that easy for you, and then they get you moving as soon as possible, and sitting in a chair hopefully to feed, because it just helps with everything and your recovery if you get moving as soon as you can. So positioning with mums and sore tummies is often a thing that we need to watch out for. Sometimes they can move their knees into the abdomen and it can be a bit sore, but we work around that. We get the baby in under the arm, or get the mum to lie down and tuck the baby in, and just do all exactly the same things. Lots of skin to skin, lots of mum time, and it's really good for mum. Calming mum down and keeping you relaxed having the baby there. So the caesarean section thing, very much the same as a normal vaginal delivery. It's just you will be taking a bit of pain relief, which is safe. If you have a caesarean section, they wouldn't give you anything that it was not okay for the baby to get through the milk. They get very minute amounts.
Great. That's really good information. And just on that, with mums who are pregnant now and just about to have a baby and going on to this journey, someone has asked for your tips on preparing for breastfeeding before baby's here. Is there anything that they can do to help make it easier or the transition into it easier?
I think getting used to handling your breasts. I think I said it last time. We don't put nipples that haven't been fed on before are a little bit tender when it first starts, and so we don't encourage anybody to put any creams or anything on their nipples. We encourage people to women to not wear bras and wear just clothes rubbing on your nipples to sort of toughen them up a little bit, because that's what really needs to happen for when those babies go on for those first times. So no creams to soften them up. A little bit of sunlight or clothes rubbing is a really good thing. So there's a question about could we talk about the question about harvesting as well here? Is it jumping ahead a little bit? Yeah,
jumping ahead a little bit, but if you wanted to, we could.
Well, some people know that they're having their babies at a certain time, and they are encouraged to bring in some milk for babies so that they can have it as soon as they're born, some colostrum, and mums are given packs that have syringes in, and they express a little bit of milk onto a spoon and use this. People would just squeeze your breast in and together, and little droplets come out, and we get you to express it onto a spoon. And from this, and you put it in the freezer, and you bring it into the hospital when you come. And so babies, if they're going to be born, if you know your baby's going to be born a bit early, they encourage you to do that. Or if mum has a medical condition, or if the mother has diabetes, we often get the mums to bring in some colostrum and a couple of the syringes. It's really good preparation for it, actually.
Yeah, that's really good that you brought that up, because we have had a couple of questions for them. Karen and Ali both asked if there was any advice regarding collecting the colostrum prior to birth, like when to start, what to use. So you've just talked about what to use.
We don't do it before 36 weeks. It may, the hormones will be released, and it might encourage you to start contracting. So, we get you to do it gently and a couple of times a day up until when you come into the hospital.
Great. Perfect. Cool. Okay. And so I thought we could talk about latch, because there's been a lot of questions come through about getting a good latch, or questions about their baby's specific latches. So I don't know if you've got some top tips for latches, or you want to talk a little bit about latches first and getting a latch, and then I can ask you some of the questions that we've had come through.
Okay. So we talk about a latch. Well, we really need to talk about a fit baby and mum fitting together. We always say it's important to make sure that's a very deep and strong position. But as some mums have big nipples and some babies have small mouths, and so we really need to move things around a bit and just get babies in the right position. And that position is very, very close to mum. I think I might grab this little fella here.
Totally.
From the very first time that we get somebody, once a baby's born, to latch, we put the baby up on the mum's chest, and we leave them there for a little while. And if left to their own devices, babies will actually move. They know they can smell their mum. The amniotic fluid smells like their mother. Their nipples have got a bit dark, so babies can see when they're born. That's why they darken up. And the baby actually, if we left them to it and we weren't all rushing because everything's getting quite medical, the baby will actually just move themselves up. And there's plenty of videos online about that, and I think you guys are going to post one on this tonight. But more often than not, we might get a mum sitting up in bed, and we bring the babies in very, very close, and we support the headlights. We never push the baby's head in. We support the baby so that they can come with their chin in first, and the nipple goes to the roof of the mouth, very, very tight. And once the baby starts sucking, they stretch the nipple right to the back of the mum's soft palate, at the back of the hard palate in the mouth. And they will know what to do. We just need to make sure that they've got enough of that breast tissue right, and they have to be right on like that, so that that nipple gets right to the back of their mouth. And off the hard palate, which is the pinching sensation that people feel. So that latch is really important. But we're relaxing a bit about the latch too. Once we get you going and you understand the feel of it, we're changing positions that babies are feeding a lot more than not nowadays, and we're not doing very structured like this. We're letting babies too go on like this, which really helps with lots of issues, and there's a few questions about it tonight. So it's not always cross cradle. It is when you first have your baby, probably, because you'll be sitting up in bed. But after you get the feel of it, we will make suggestions of what else might work for you. Perfect.
Great, thank you. So running into some of the questions now. Someone's asked again, Ashley's asked how to know, want to know more about getting a good latch, which you've just talked about a little bit, and how often when to switch sides, and how to know when you should switch sides.
Okay, and so I didn't really finish off what I was saying before, but a good latch shouldn't be painful. That's the thing about latching, is we always ask, is it comfortable? Now, asking a woman for a first time when the baby's on there for the first time, these babies suck really strong, unlike anything else that has been sucking on there before. Very strong. So you just have to be prepared for a bit of discomfort, but not pain. And if you think and say, look, it's very painful, we will take the babies off and try and get more of that nipple in their mouth, so it goes to the back of their throat and it's more comfortable. So the latch, we want it to be comfortable for you. But we know when it's not, as it's possibly causing damage, and that goes on and impacts on this beginning journey that you have. But the question from her was, how do you know the baby's getting enough?
When to switch sides, and how do you know when to switch sides?
The first 3 days after your baby's born, and after is very different. So the first 3 days, a newborn, we let them on there and feed until they won't feed anymore. And we might encourage them to feed a little bit more, because they'll get a bit sleepy, the newborns. We might change the nappy to wake them up, but we give them as much as they can take on one side. And at the beginning, we're always going to offer them the next side as well. So there's nothing about, it's just trying to keep it even at the beginning. It's not about switching sides as such. But once your milk comes in, that's a very, very different story. So those first 3 or 4 days, it's really just getting the baby on and taking off those tiny increments of colostrum that they need, and is a marvellous thing for them to drink. So it's not about switching sides at the beginning, but when your milk comes in, that's very different, isn't it?
Yes, and we've got quite a lot of questions on feeding and stuff, so maybe we can talk about that a little bit more when we get to those questions. If someone, Elizabeth has mentioned that her baby's not latching good enough anymore, and she's wondering if she needs to reteach the latch. She said it's because of wind, and she just feels that the baby's uncomfortable and not able to latch very well anymore. Is that something that she can teach to baby? And how best
definitely
to do that?
and quite often we might go, and I went in to see somebody the other day, and they were 3 weeks down the track, and she'd been feeding for a wee while, but getting very relaxed about it, and the baby was too, and she started to get sore nipples again. And I said to her, let's just go back to basics and bring the baby in with their chin very, very, I'll do it with this, very, very close in, and it rolls on to their mouth, and we go back to the basics, bringing them right in close making sure their chin's in first, and seeing what it feels like. So you can reteach them. And also going back to skin and letting the baby let you know when it's time to feed is a really good way of getting them to do that too.
Great.
So you can definitely teach them.
Okay, great. And Frederique has asked ways to help breastfeed a tongue-tied baby. In the current climate, we're getting a tongue tie corrected isn't possible for quite a while. So just wondering if there's any tips for if baby is tongue-tied or suspected that baby's tongue-tied.
Yeah, and so Frederique, you might get to the end of when it would be possible to get the tongue tie seen, and you might realise, well, you don't need to do anything because you may have been able to fix it. But the leaning back position where a mum can, I'm going to just adjust this so people can see what I'm doing, but getting babies, even sort of 4 or 5 day old babies, even though they haven't got head control, if we lean back and we bring the baby right up underneath, and their chin comes in very deep, and it's much easier. You can't even see there, can you? But the baby, it's we lie back. It's much more comfortable for the mum, and the baby gets their chin in, and it's much easier for a tongue tie. And this is one of the first things we'll do, is to try a different position for a tongue tie baby. And it's important to not let the tongue tie put you off, because I'm not sure who said a baby had a tongue tie, but a lot of them just have a bit of skin, and if their tongue is able to come forward, we often don't do anything about it, because often they can stretch themselves. So it's more about positioning for a baby with a tongue tie.
Great.
Yeah. And we need to keep stimulating your milk supply. If you do genuinely think, and someone has said your baby has a tongue tie, we need to keep stimulating your milk supply, because that can drop off. So lots of extra time on the breast for that baby.
Great. Yeah. That's really helpful. And so Cindy has, she's got a 4-week-old. And she says that baby hasn't latched properly since day 1 and makes a lot of clicking noises when on the breast. Apparently feeds well and is gaining weight.
Good.
She's wondering if baby's spilling a lot, and when he's on his back, it kind of sounds like all the milk is in his throat, making terrible noises. And she's just wondering if it's possibly the latch that's causing all of this, or would you, like the clicking, is there anything you think that she might need to do or change? Yeah,
well, the good thing is that baby's feeding well and it's putting on weight, which is 2 really, really good things. Sometimes babies bring up milk a lot, and it might be just the fact that they don't sit upright for a couple of minutes after a feed, lying them down. We don't do that, and it's often the milk comes up like that. If the baby isn't spending a lot of time crying, I wouldn't be that concerned, although that click, we always say with a click it mightn't be a very good latch, but you might notice that the baby is sucking its bottom lip in, and if you got your finger in and pulled the bottom lip out when they were feeding, you might notice that they get a better suck. But the fact that baby is putting on weight and a reasonably happy baby, I would persevere. And that in 2 weeks you'll be going to your GP for vaccinations, and so they say to them and get them to have a look in Bubba's mouth for you too.
That's good advice.
Because that's the only sort of medical practitioner you're going to get to in this time. So your GP in 2 weeks, I would just keep persevering. But you might notice a change in position also, and that leaning back one again, if it is something physical, the leaning back and supporting the baby like this and just getting really comfy on the couch, actually you might notice that the click disappears. Yeah.
Okay, cool. Thank you. And Alex has asked how to transition a retrained baby from bottle to breast. Unfortunately, they said that unfortunately she had to start it, but would love to continue breastfeeding for at least 6 months. So I guess something's happened. She's had to give baby a bottle, but wants to train baby back onto the breast from the bottle.
Mm-hmm. And I don't know whether just, trying not to force it and to let it be a bit more natural and really calm would possibly do that even without any other intervention. And I'm going to go back to that, lying and just letting your baby there and being gentle and calm, and they might even have a bit of a sleep on your chest, and they might start rooting around, which tells you, and you could just gently move the baby over towards there. And if they're how old did you say the baby was? Is it
they haven't mentioned, they just said unfortunately had to start the baby on the bottle, but they want to know how to best transition or retrain baby from bottle back to breast.
As long as you've still got a good milk supply, I think that it would be easier than you think, and just being confident it will happen, and just gently spending time with baby at the breast and just not forcing them. Get a bit of milk down, get the milk flowing a bit, and putting baby on. And once they start sucking and the milk comes to them, I don't think they'll turn back. I think it'll be a lot easier. I think it'll be a lot easier than you think. But if that didn't really work straight away, and it depends what sort of teat you're using, you might want to ask somebody. If you've still got a midwife who's involved in your care, you might want to talk about whether transitioning with a nipple shield might make the baby think they're feeding off a teat and then removing the nipple shield. That would be the other thing I would think. But I think if you're just doing it calmly and be confident it'll happen, I think just spending time, that baby will get on.
Fantastic.
Yeah.
Great. So now, Libby, I thought we'd talk about different feeding positions. Can you talk us through a few of these different feeding positions? You've already shown us a couple just in general conversation, and what scenarios they might be good for. For example, one of the first questions we've had is how to deal with a fast letdown. So I don't know if you could talk us through that.
So this is a very standard one that we teach women at the beginning, and it's quite a nice one. A cross cradle. We can drop the baby's legs and bottom a bit more if you want to. If a woman, and there is a question about larger breasts I saw came through, but we might get a woman if she's got a larger breast like this breast here, and it just depends where the nipple falls. So if she's got a larger breast and the nipple's down here a little bit, we might do what we call the football hold, and that is when we do get the baby on a pillow and get them lying on the side, and same principles, very close in, chin coming on first, and that nipple will go in quite nicely, and the baby just lies. It's a very nice way to feed. It's a good thing to try these different ones. This is a lovely way to feed because you look straight into the baby's face, and it's very engaging and lovely. And the other one that is super popular, and I've already shown you several times, is a lot of us are showing you how to do the lie back or the biological feeding position, and so that's something women can have a look at. And it's putting the baby on your chest and just supporting their head initially and just letting them mouth around, and quite often you don't have to do much for them to get on at the beginning. And so that's a really another one that we are trying. If the baby isn't going to go this way or football, that is the good three standard ones that we like. And there's the lying down one, and you're literally lying down on the bed, and it's quite nice because baby just tucks in there. Often your arm supports their head. You've just got to get baby up to the level. You sometimes lean back or lean a bit forward so your nipple comes down to them, and you can do that quite nicely. It's quite relaxing way to feed. But of course we wouldn't want you to go to sleep with baby there, and we'd want you to when they finish, pop them in the bassinet or win them or whatever. But that's a really nice way to do, and we encourage that in the hospital, when mum's really tired. And so going back to a couple of questions around the how tips for issues with forceful letdowns or the fast letdown, that would be more the leaning back type feed. Yes, it is. It is, because you have the nose and the mouth above the nipple, and so it really slows everything down, and the baby is able to control the flow. So babies are very clever. If the letdown is fast, they learn to put their tongue in the way to sort of stop it when it's coming to them. This is one of the things too that we'll get you to do is let the baby take the milk at their speed.
At their speed,
for a fast letdown.
Which
brings us on to some people may like to express it a little bit off too first. If the baby's choking and coughing and getting quite windy. We would suggest maybe doing that too.
Doing that as well.
Yeah, so that first letdown, which is like 45% of the feed is in that first letdown, so it's a hell of a lot of milk coming down to the baby and a lot for them to cope with. So removing a little bit at the beginning just slows it down for them.
Perfect. Someone's actually asked, what are the best breastfeeding positions? Well, I think you've just explained the breastfeeding positions, and it kind of just, I guess, depends on what works for you and baby and what your letdowns were.
What your breasts are like. Oh my goodness, there's so many different things to do it. And nowadays we don't have to do the absolutely sitting up with a straight back. We do that initially because you're going to spend lots of hours when we're trying to teach you and you're doing it, every 3 hours for an hour at a time. We don't want you to get sore shoulders, but really the go-to is pretty much this as well, across and dropping the baby's bottom. You can sit on a couch with your feet up and just let the baby feed, and it's so nice and relaxing if you are able to do it like that.
Yes. And someone just asked, is there the best position for a Spilly baby? They think they've got a fast flow for let down. And she can do some very large spills, so just slightly concerned about that. And is there any position that would help that, or is it?
A lot. Sometimes babies do large spills because they've got for that baby in particular, there's nothing wrong with when the baby starts to stir and tell you that they want to feed. I think it would be kind of a good idea to see if there's any wind in that baby before they go on the breast. So, it's not a bad idea. Quite often when you pick a baby up and you don't realise they're windy, they might do a big wind. But for that baby that's tend to be spilly, several things. Some babies can spill a lot of milk and be quite happy about it, and it's not like indigestion. We just call them happy chuckers, but they're very messy. They create a lot of laundry. But if they're happy, we don't worry. But we do see if they want to feed again. But I would try and control the speed at which that baby's getting milk again in this altered position that I keep going back to. But it's so much nicer to feed in, and the baby can take it much slower, and that's possibly why they are spilling so much, is the speed at which it's coming. Or if the baby, the mum, or I don't know how she's feeding, but maybe if the baby's feeding quickly and has two sides quickly, that often makes a baby a little bit more spilly too.
Right, okay. Okay, great. And this is our question about the lady with the large bust. Kelly says that she's a 16K and she's heard that large breast can pose challenges when breastfeeding. Any tips? I know you did talk about that specific football hold, but
there's something specific that we do, and quite often we might go to a football hold for a mum with larger breasts, and that's because where the nipple sits. But we do that. We might at the the postnatal care place, we might set you up with a chair right next to the bed, and we'll get a pillow so that babies, and the same principle, babies up and very, very close to you so that their chin comes onto the nipple, doesn't go in the middle, but the chin comes on, and that nipple can go to the back of the mouth. So that's our go-to position. But women with enlarged, the larger size, we call them generous breasts. They're not, large or too big or anything. Often we might roll up what you would have as like a nappy at the hospital, or and we tuck it under the breast, and it sort of tilts it up, and it can change the position. So that is not a bad idea too, is to roll something up, tuck it under your breast and just tilt it up. Quite a common thing that we will do. There
was another lady who had the same very similar question. She said similar to the lady above. has had difficulty getting a deep latch, nipple pain with blocked ducts due to the poor latch. She's struggled with her breastfeeding child number 1 due to the same issues.
Yeah.
And she was hoping for better luck with child number 2, but already experienced the same issues the last 4 weeks. So probably some of that advice that you've just said,
yes, I think
might be good for her to try as well.
Yeah, and it'll be a position thing, and I bet you there would be a position that she, with a little bit of help and maybe a few bolster things underneath, would be able to get the baby on, and not all babies fit all breasts, but just for her. And that baby will get stronger and be able to help her with this. But I think, and she will have already gone through, I think she said in her question, she went through the football hold and all that. But maybe a different sitting position for her, and using something rolled up and just tucked under the breast is quite a good thing. It changes the whole shape. Yeah. Yeah. And just, be gentle with the baby coming to the breast, I think. Not forcing them and just being really gentle. It makes babies a lot happier to just sort of find their way. Yeah. Yeah.
There's another lady, there's a few more coming through again about that fast let down, and we've talked about that kind of feeding lying a bit further back. There's a lady called Andriana who has asked live on Facebook. She's asked, she's actually got a 9-month-old. Yes. So she's obviously been in the group and she's still here, which is fantastic. And she said that her baby is teething and the latch has got very sore as well as biting. Any advice on that?
Yes, I do have advice for that. Somebody called me today. I set up a chat, which I'm doing a lot of, for a woman whose baby was 8 months old and had 4 teeth and it was getting really sore. So I said to her, what do we say to her? You can actually, we were always taught, and I think it is a thing, but at 9 months old, you could, if the baby is biting, it is okay to say no and take them off and maybe put the baby somewhere safe for a minute. They won't like it, but you would be able to tell them that it's not okay to bite. And if you do that every time, it may stop them from doing that. The other thing I told this lady to do, I told her to do 2 things. One of them was that. But it's basically if the baby and not letting the baby pull off, because if there's teeth and they're doing that and they're holding on to the nipple and it's really very, very sore, as if the baby goes to do that you, whatever position you're in, you put counter pressure on them so that they don't pull off like that. And they will be pulling for a reason. They might be wanting another letdown because they do that sort of behaviour too. The milk's too slow. They'll pull and you'll release more milk and then they'll have the next part of their feed. So pushing them in and trying not to let them do that to your nipples would be a good idea. But you can say no, not too loudly, they'll get a terrible fright. Delatch them and pop them something, they will learn not to do it. I had it, my second baby started teething at 3 months, so we fed for a long time with her teeth, but she didn't try it actually. Because it was so early.
Cool. Another one that's come through online as well, just a couple I'll keep now that we're still talking about latches before we move on to feeds a bit more, is that there's a lady who wants to know if there's any advice for feeding with, this is from Fiona, with inverted nipples. Struggled with first child, so hoping it's going to work better for second baby.
Yeah. And probably if you struggled with the first, you might have done all those things. Some people wear shields. And because she's fed before, her nipples might actually come out a bit more this time. But there's this shield things that you put in your bra and it forces the nipple to come out, be pushed out. Because she's fed the first time, I'm hoping she fed, did she say she had problems the first time?
Yes, she struggled with the first child, so hopefully it will work with the second baby. So I'm not sure if she...
So that's when we might suggest a shield for her to latch with, and I do have one, but it's very much one of those things that you would ask your midwife if you should use it. And I don't know if people can see this, but it's a little silicone shield that we get people to pop on their nipple. This nipple and breast would need a larger shield, but we put that on, and if the nipple part doesn't come out, then the milk will, and the baby should be able to suck that out a little bit. And I don't know if that lady did anything about rolling the nipple or trying to get that out before she fed, but I'm hoping she's going to have some really good support this time to make it much easier for her. But it might actually be much easier. I think her milk will come in sooner, and somebody might get her onto the right size shield.
Great, thank you. Good advice. And Shannon has messaged online as live and is saying, I'm getting some really sore wrists holding baby while I feed. Are there any tips that might help? She's using the classic hold at the moment.
Yes, so that's why, and it's not uncommon because we tell women to push the baby's shoulders in with that part of our hand and to not do that. So I can't remember how old Shannon's baby is, but
doesn't say actually.
Yeah, and she might. I know once the levels change and we go down a bit. I know that acupuncture is really good for that pain of the wrist. A lot of people who may have carpal tunnel use that. But just trying a baby, just having more support underneath the baby. If you have a pillow. To bring baby up, and if you're doing it the classic, you might do that, but you might put something rolled up as well underneath the baby's head so that you don't need to have to keep pushing them in like that. You could do that.
Yeah.
Or I'm just going to go to the other position that I've been going on about all night. But if you did do that, you're not pushing anything in, and your baby, you actually support the baby like this, or you could put the hand there. So. But rolling something up and supporting your hand would mean your wrist isn't bending anymore. Yeah. So I think doing this lean back comfy one, it'll stop her sitting there pushing in. So I hope that works.
Great. Good advice. I'm just reading a few more comments here. I've got Rebecca Cunningham. Sorry, she has suffered with nipple vasospasm.
Oh yes,
vasospasm. I hope I've got that right.
Vasospasm. We call it Raynaud's. Yeah.
Okay, with her first child, and she had to stop breastfeeding. And I'm about to have another baby. Anything I can do to reduce or prevent this? And I know that when you mentioned that, there was another lady who had something similar, saying that she had really sensitive nipples, sort of touch, even when not breastfeeding or pregnant anyway. And if there was any advice around that.
So, first of all, that we often say taking magnesium helps with the spasm that happens. People take it to calm the brain down, for sleeping, jumpy legs in pregnancy, but magnesium, which you can just buy the Thompsons from a health food shop or a supermarket, I think, can minimise the vasospasm that's happening.
Okay.
If this lady is having her second baby in winter, I would suggest that you get some woolen breast pads, and you just try and keep them as warm as you can, because once they get wet and cold, that's when the blood vessels dilate and contract and the nipples turn different colours. And I think that would be the same for that other lady with the very sensitive nipple. There's all sorts of pads that you can get that have got silk on the inside and wool on one side. And I do actually know, because I've been reading up on this, somebody has designed some proper wool breast pads because they had this exactly same thing. So I'm going to leave it to that lady that knows that she has it to have a look. And I'm not going to say where I saw it because it's not the sleep store, but there is if she just had a look for nipple pads, it's a breastfeeding mum that designed them. She just made them for herself, and she started making them to sell.
Perfect. Yeah, that's great.
And magnesium.
That's great. Okay. So I thought we'd start moving now on to, we'll come back if we need to, but I think we'll start moving on just around more feed type questions. So we'll start off, I know when I was breastfeeding, people talk to me a lot about fore milk and hind milk, and I just thought these mums have probably heard these terms, and I was just wondering if you could give us a bit of an overview of what that is, or they're referred to a lot. So
so we do talk about we talk about the fore milk and hind milk, and it's really about the changes in the milk. Lots of studies have been done on this. A male doctor called Jack Newman has done a lot of studies on the composition of milk and why it changes and why babies get fussy and why do they want to feed more often than not at different times of the day. But we know that when a breast is full and when it starts releasing the milk, the very thin milk comes out first, and the fatty milk is left inside towards the end of the feed. And so the fatty milk comes out at the last part of the feed. And so when we want babies to go on and really try and empty the breast so that they get that fatty milk, which is really good at putting on weight. And important to try and stop them with getting that green poos and a bit of an upset gut. And we know that babies towards the end of the day, they feed a lot because mostly what's in the breast is that fatty milk, because it's at the end and the breasts are a lot softer. So they want to feed more often towards the end of the day, and people think, oh, my milk supply is not as good, but it's not about that. It's the type of milk that they're feeding. And so and we don't know when it changes, but they sort of sometimes say after 10 minutes, but there's no scientific anything to back that up. We just know it's when the breast is getting quite empty that the fat milk is the one that's going to start coming out.
Right, interesting. Yeah. So the forceful letdowns will be more the fore milk?
Yes, it is. And then it changes as the breast empties. And that's why we like, it's really quite good to, once your milk supply has established, which is not really for 2 weeks, but not in the beginning. We get everybody to feed from both breasts all the time, but some women might find, and you probably would make enough milk, after 2 weeks to just see if the baby will just feed off one side, because you empty that breast right out and the baby gets that more fatty milk.
Great. Thanks for that. It was just that I know that as it terms that get
yes, it is
around. I do see people talking about them in our groups and things like that. So I just thought it would be great to get a bit of an overview. So from that, leading into feeding and switching sides and burping, we've had lots of top questions come through around this. So can you give us a bit of an overview on maybe hunger cues, switching sides, how your letdown works, etc.? I know you said earlier that the switching sides isn't necessarily as important.
No.
Yeah, so I thought
the other way,
earlier.
Yes, it's not as important at the beginning.
Earlier, yeah. But now it's a bit more important as you.
So when you first go home, yes, we want you to stimulate both. At those first 4 or 5 days, feeding. I think it'll really set your milk up for a month down the track if we just get the breast going as well as they can and getting all those receptors working. And we do that by frequently feeding baby, and we generally try and do both feeds at the beginning. Then at about 48 hours, 10 hours either side, your milk comes in, and that is the second sort of part of lactation, and your breasts fill up and may get overfull, and the baby feeds, and you slowly stop overproducing, and baby starts taking off what they need per feed. And at 2 weeks, I said your lactation should be established by then. And I've actually forgotten the question because I've gone off on a tangent.
That's okay. It was just to give us it's a good tangent. We're just wanting an overview on feeding a little bit, and hunger cues, switching sides, how your letdown works, etc.
That's what I was getting to. Is that when you go home, or by about 3 or 4 days, a new mum tends to sit there for a good 20 minutes feeding a baby on one side. That's a good amount of time. Maybe 25 if the baby's still alert and they want to feed, we let them do that. Once your supply comes in, they often don't need to feed, it changes. Like some people don't realize that, 5-6 days, the feeding really starts to change. And by 2 weeks, it's very, very different.
Yeah.
And the babies might feed for 10 or 15 minutes on one side because they're stronger and they're much more efficient. And if you're getting them on really nice and close, they take the milk off efficiently, and they get their feed a lot quicker. So it really changes quite a bit by 2 weeks.
Yeah.
And, we know that they've had enough because they just won't take any more in. You should never stop a baby when they're drinking and you can hear them swallowing. We should really be guided by them when they've finished at the breast. It is okay to sometimes, wake them up a bit because they've got all warm and cozy, and if they're overwrapped, they'll sleep sooner. Sometimes we say take their clothes off so they're a bit cooler. And they'll finish the job better. But when they have finished and just really won't take any more, that's when we take them off and we give them a good amount of time to sit up and to release this wind, and then change their nappy in between, and then offer them the other side. But if the feeds are getting too short, that's when we might say, look, you've got a great amount of milk, you could just start doing it. Put the baby on one side 10 or 15 minutes, do the winding and change the nappy, and putting them back on. Empty that breast, and then next time you would feed from the other one.
Yes, that's what I did. I remember that I didn't.
But it didn't happen straight away. It's should establish.
Yeah.
So the feeding cues of babies are not a baby lying there in their wherever they're going to sleep, crying and sucking on their fist. It's them opening their eyes and just turning around and licking their lips. It's that we need to pick up these babies and feed them earlier rather than later, especially at the beginning, because when you're learning to feed and they're learning to feed, if you leave the babies too long until they're crying, they're all flustered, and it makes you flustered, and it's not such an enjoyable experience. So the yes, the hunger cues are licking their lips, moving around, opening, closing their eyes, shimming around, maybe a little bit of a cry, but you need to pick them up early at that time. It's much, much better for baby. They have a less fussy feed and much nicer for the mum too. Yeah, late cues are the crying.
Yeah. Cool. And I think a concern of mothers is always, how do they know if their baby's getting enough? When you're breastfeeding, because it's not, you can't physically see how many mils they're getting or anything like that. Can you give any advice around that, or and then maybe touch on what low supply would be? I guess that would be maybe a different topic, but
so knowing that babies have had enough, I think in the early days you get a midwife visit and we come round and we ask about the baby's output, and in the first couple of days we expect that they have 1 or 2 wet nappies a day, and maybe 1 or 2 of those meconium poos, which is that black sticky stuff, which is the lining of their bowel, and then by day 3 they should be getting more colostrum, and your milk will be coming in, and we'd expect 3 or 4 actually really good wees, and more, and bowels starting to change and more often. But also with the midwife coming in, we're asking you those questions. So it's important about output. It's important about how settled they are, because a well-fed baby will sleep for an hour and a half or 2 hours. And so we ask you about their feeding pattern, and also we check their weight at the beginning, and that's that's all that we sort of go by. But if you're at home and it's 6 weeks and you're not sure if your baby's getting enough, you still would be guided by what their output is like. Their poos drop away if they don't get enough, and they're unsettled and fussy, and you just can't seem to get much time with them not crying, and you might notice that your breasts are a bit softer. And a low supply, all you need to do for a low supply is just take some time for you and baby, and to drink well, and put the baby on frequently. A lot of people have pumps these days, but if you fed your baby and fed them until they, it looked like they didn't want much more and they were going to sleep, if you put them on the other side and fed straight away with a lot more milk again, they will take a lot more, and then go back to the other side and get them to feed the next let down. It's called switch feeding, and that actually lifts your supply again for them. It literally is demand and supply with, some people, drink special teas, lactation teas, or but it's really about what's being taken off, getting the baby on and getting them to have good feeds and deep latches very, very close in the chin, and stripping that milk off, and if they take it off properly, your body will replace it.
Fantastic, good advice. So Alexandra's asked advice on knowing when baby's full, and which you kind of touched on just now, letting baby guide you on that. And should she keep trying to wake him to feed the other side, or is one side enough? She hasn't mentioned how old baby is, but and we
until we know if baby is and often this is a pattern at night, that babies will only want to have one breast because they wake up, and it's fair to say that some parents don't get to their baby until they are crying because you're so tired at night. But that's so, and the babies are ready and they'll get on, and often at night they'll just get on there and power feed and only want one side. And you'd be able to work that out, because if you put them back to bed and they're up an hour later, then you probably should have woken them up as much as you could have and got them to have a bit more on that side. So, a well-fed baby often will, after they've been on 2 times, will often fall asleep at the breast, and their mouth will be open and milk will be dribbling out as well. They're the very lovely drink. It's such a gorgeous thing to see. They're the happy baby, and they are happy and they're full, and they should be, and it depends on their age. It really depends on age.
Okay, so talking about that, we've got Joanna who's messaged and said that she's 4 days in, so her baby's very young. Do you need to offer both sides for each feed? So I know we talked about this a little bit earlier.
I definitely would at that stage. Let baby feed as much as they want to it, and because it'll set you up for really good milk supply later on. So I wouldn't be just giving one side at all.
Great. And she's also said that her
change baby to wake them up.
Yes, she said that she's doing that. She said that she's changing him and offering the second, but he doesn't really go for it unless she's had trouble with the first side. And she does say that her right breast is a bit harder to latch. So if there's any advice there, or
well, I'm wondering if that right breast is getting a little bit overfull. If she's 4 days in, the milk comes in, and sometimes one releases milk a bit easier than the other, and some mums prefer, because they know the baby feeds better on one. That's a common thing, and one might get overfull. So there's 2 things I would say to you, Fiona, is that sometimes a mum is a bit better. I'm guessing you're latching sort of in a standard cradle hold position. Some babies prefer it like this, and it might be due to having a difficult birth and having a bit of a headache, and they don't like going on the other side. But we could feed a baby like this and they are fine. And if you're having trouble getting them on the other side, what I would suggest is you try and trick them into thinking that they're on this side, and you do exactly what you do with your hands this side but under your arm, and do the same thing. And it can sometimes trick them into it. And once you talk to a woman about breastfeeding, often they will say, I had to feed the 2 different ways. And often it's the mum's dexterity with the hands. I always show feeding on this side because I'm actually a bit cack-handed this side. But it's the same with feeding. But that breast might be getting overfull, Fiona. And if it does, yes, sometimes the nipple disappears because the breast is getting full and it might be a bit engorged. And so we might say to you, it's I think at 4 days I wouldn't bother pumping as such, but you could release a bit of this pressure. It might be a bit swollen around the nipple where baby wants to get on because there's too much milk here. And so we get mums to do reverse pressure, and we're literally trying to push the swelling away from the nipple. And you can do it with 2 fingers. You can do it with your fingers like that, but you go around the nipple for about 20 seconds each position, and it pushes the fluid away, makes it softer for baby to get on, and they should be able to do that.
Oh, that's good.
Yeah. It's called reverse pressure, and it literally pushes all this fluid away, and baby can get on a bit better because it's softer.
Oh, good.
Either change the position and or do that as well.
Great.
Good luck with your journey.
Terry has asked, I don't know if we touched on this, if there was an average feeding time on the breast. I'm not sure if it will be all the same. Or...
Tara, at the beginning, babies feed for quite a long time, and then they get, and I'm talking 15, 20, 25 minutes each side. Okay, and we want them to do that. When they get a bit more, when they get to about 2 weeks, they become a bit more robust and efficient at their feeding, and your milk supply is different at letting down, and often a 20-minute feed might drop to a 10 or 15-minute feed. But it's really, you want your babies to drink until they're full. And so you just try and encourage them to have as much as they can every feed. And if your baby is always going to sleep, once your milk comes in, they do that. It is worth taking, especially the first part of the feed, and I think especially at night, I think it's worth taking a layer or 2 off so that they're cooler and they get the job done and they don't keep falling asleep. And so there isn't. We really just talk about at the beginning, they do tend to feed a lot longer. It takes them a bit longer to feed, and then they get very efficient. Some babies, they end up being maybe 7 minutes on one side, and do you remember them getting quick like that?
Mine were quick. I definitely had fast let down and quite a lot of milk. So they were there for a good time. Fast time. So I do recall that. Now Louise asked, how often should feeds be during the day and night once baby is a little older beyond the feeding on demand stage? So I'm not sure. She hasn't mentioned how old baby is or what this. It is a newborn group, so I'm not sure. She's mentioned dream feed, so I'm not sure if she's potentially a little bit older.
It's a hard one because babies will cluster feed for various reasons. Like we know at about 10 days they almost definitely have a growth spurt, and they cluster feed then. They feed and feed. They do it about day 2 after they're born, and especially in the night. And then about day 10, they have another bit of a clustery feed. Dead on 28 days, they definitely have a cluster feed, and it just lifts your supply to the next level. 6 weeks, they do that again. In 3 months, they do it again. They just need that. And so I think that a baby, and we don't know what age your baby is, but once they get past 6 weeks, I still think they're probably feeding 4 hourly in the day. Still feeding 3 to 4 hourly in the day, and I'd expect that they'd probably have at least a late feed, 10 or 11 at night, and at least 1 in the middle of the night, and then a 6 or 7 o'clock. So that's not really answering your question, but I think that's what a baby would need. Still 6 feeds as they progress and get a bit older, but I'm not sure specifically how old
because
the baby is.
Have an age.
And babies have growth spurts, and that you might have started doing a lot of exercise, and you might need to boost your supply a bit by just going a bit gentle. I don't know what the story is there.
Okay. And Bonnie's asked, can you please explain how best to use top-ups, timings and amounts? Thank you in advance, she says.
It depends, Bonnie, why you're topping up. It's reasonably common for midwives to suggest maybe in the first 2 weeks, if the baby's weight isn't going on as well as we think it should, we might get you to express and to top the baby up after a feed. Now, I don't know how old Bonnie's baby is, but if she's feeding and it's under a month, we might start off a newborn. We get baby to feed on the breast for as long as possible, and we might start with as much of your milk as you can get by expressing. 30 mils is considered a top up early on for the first week or two, and then we don't want to top up too much because the baby will sleep too long and they won't wake hungry to feed properly again. Right, yeah. So top ups get up to about 50 mils. We don't want them to be much more than that. What was the second part to the question? It just depends if you're doing it because your baby's come out of NICU, or you've been told to because Bubba's weight isn't going on very well. I'm just not sure why it is.
Yeah, no, that answers the question. The other thing was about timing, but you just kind of talked about that and amounts. So, okay, great. And Terry's asked, how does the letdown work? Is it the same on both breasts? And as an example, she said, if I collect 60 mils in my haka on one side, is it safe to assume that baby's had 60 mils to drink on the other side?
Because I said that possibly, yes, they have in that initial letdown, and then they'll probably have, it depends how old the baby is, but they've probably had another 20 mils after that. But that first letdown she got on the other side, that is safe to assume. I think the baby will probably have about 80 if she gets 65 on one side.
Oh, great.
Yeah.
That's good. And are you able, Ashley wants to know if you're able to give your top winding techniques for a newborn, and should we be burping after every feed?
Yes, okay. I have this lovely Bubba here, and a newborn in those first couple of days doesn't take the huge volume, so I don't feel that it's as you don't need to do it as, it's not as important in those first couple of days when you're just getting used to your baby, but it's a good thing to do it to get used to handling your baby. Once your milk comes in and they start drinking bigger volumes, they will swallow some air and they will need some winding. And my most favourite technique, everybody, is leaning the baby, straightening them up so they can let the burp out, is leaning them over their chin and your thumb and your forefinger, or this other finger. I have my fingers underneath the baby's axilla, their armpit, so they're nice. Look, they're nice and secure, and I really put pressure in the back. I don't pat the back. I think, and excuse me, but people have there's a few doctors that have put out things, but they feel that if you tap the back too much, it breaks the air bubbles up, and you want them to. So I've read that since, but I'm not a big tapper. I'm a rubber. I sort of jiggle the baby because I can imagine trying to get the wind out from maybe underneath some milk, and do a little jiggle. Not a big thump, just a little jiggle like that with my knee and a bit of movement. And often that will get the baby's wind up. And I often pick them up a little bit. They're safe in my hands here, and I put them back down on my knee. I think it's a good idea to get rid of the pillow if you've been feeding with a nursing pillow or whatever, and put them on your knees so you can lean them slightly forward. Okay. And the jiggling is a thing that they think releases the air. And lots of people suggest that if you don't get it out in the first 15 minutes, that it might go down and become quite a sore tummy, and that's when they get gripey. So it's good to do it properly. I think it's really good to do it straight after each part of the feed. And this person I was reading today said quite often if you pick a baby up, they want to do some wind before they feed again anyway. Yeah. Okay. So that's my top one. Do you want to see my next one?
Yes, I'd love to.
It is over the shoulder, and I don't want the baby's knees to be up like that because they can't release, and you sort of, if you grab their bottom and just sort of jiggle their hips, their legs will come down, and just the straightening of the back and the torso up over here, and just wiggling them just like that seems to do the trick as well. Okay. Yeah, so that's
learning something new.
Yeah, I love those two, but my favourite is over the knee. Yeah. And there's nothing to say you can't put your baby quite securely between your breasts and walk around and do something. Just the upright position will often release it as well. Yeah.
Great tips. I learnt something there. Hadn't seen that one there.
The wiggly, yeah.
No, I hadn't seen that. On that, the burping, Sean said that sometimes her baby does a massive power chuck, like at the winding process, so very spilly, and it looks like he just brings up everything that he's just ate. Right. Is that okay? Like for spilly babies, there has been a few questions around that sort of thing.
Yeah, as long as the babies are happy. I wonder if I think just be a bit gentle with the baby. Baby might be overfeeding, and so I don't know, if you're patting the back, it might make them, I'm not sure which way you're doing it, but the amount that they spill, I would offer them another feed after they've done that. If they're happy and not crying because they've got acid coming up, I wouldn't worry about it. I would just give them lots of upright time. In fact, it depends how far the spills go, actually. If she's got a male baby and he's her first male baby, if the vomit goes a very, very long way, I would get the baby just to be seen. But if it's just, straight out, just down on the floor, then that's fine. Okay. As long as they're happy. And as I said before, happy chuckers, and they just create a lot of washing. Very messy.
Cool. We've had a question online from Samantha. She said that her 3-month-old still feeds around every 2 hours during the day, but sleeps 8 to 10 hours for his first stretch at night. Is this okay? Tried stretching him out during the day, but no luck.
I guess it's sleeping a very long time at night.
Yes.
I would leave your baby. I would leave your baby feeding lots in the day and giving you a good night's sleep. I'm just wondering, her breasts will be really full in the morning. But if she maybe expressed a bit before she went to bed, if she knows baby, I'm hoping she's sleeping with baby in her room too, so she can hear. But if baby goes to bed and she doesn't go to sleep for a couple of hours, I think it would be really good for her to take off, a feed, because the baby, she'll be very full the next morning, I would have thought.
Yes.
Yeah.
Okay, so
I wouldn't try and change anything at all. I wouldn't. It sounds fantastic.
Yes. Okay. Great. Sorry, that one was just one that came through. There's been another one that's come through. That from Ashley. I've been feeding from one side, but expressing from the other. And how can I gauge how much express milk to give my 12-day-old? So
I wouldn't. I would just breastfeed your baby. I don't think, unless there's a medical reason, I would just give your baby your breast milk. As long as there's no medical reasons to do it, just at this stage, just keep breastfeeding. And it's a good idea not to give them a teat until after a good month, until I've got it sussed, I reckon.
Okay.
It sounds like you've got a great supply. Really good supply, but I would just put the baby, I would just feed your baby off your breast.
Okay, great.
I don't know, is it any clearer, the question, that one?
No, there's no question as to why, but she's feeding from one side but expressing from the other, so I don't know if there's an issue with one. And she wants to know how to gauge how much express milk to give the baby. So maybe she's having to take it off on one side. There's no more info from than that.
Oh, yeah. Well, that mum might have a really sore nipple. It might be
something like that.
12 days old, I'd probably give it 50 mils maybe, but I'm just not sure of the situation. Yeah,
exactly. Yeah. Okay, great. So if there's no real reason to be doing that, then try just using breast.
But the other thing is that she's obviously got a good supply, that she's got the pump off the other one. She might be at the stage where she could put the baby twice on one breast. I don't know.
Okay.
Yeah. Not sure.
If she take it off.
Sorry.
That's okay. Alex wants to know, is there anything you can do to avoid hiccups? Is waking up our 2-week-old and he struggles to get back to sleep after feeds.
Yeah. I say that you don't necessarily, but this is not an answer to a question, but babies get lots of hiccups. Quite often giving them a quick feed gets rid of hiccups. But you don't have to keep them up until the hiccups have gone to put them into their bed, because usually they go off to sleep and the hiccups stop. Most babies cope really well with hiccups. Some people sometimes might put the baby on the breast and give them a quick thing to get rid of the hiccups.
To get rid of them. Give them a feed. Okay, great. And so Karen's asked if it's true that there's certain foods or supplements that it can encourage supply, and if so, what are those?
The best thing to encourage your supply is having lots of milk taken off by your baby, so feeding lots and lots and lots. There are teas that are sold in health food shops, which are, they're safe to take, lots of well-known brands, and they tend to sort of help to increase, and they usually have fenugreek in them, which is what people take. Eat biscuits with fenugreek or fennel in them, and lots of vitamin B12, like that old-fashioned stuff. Brewfax or savoury yeast is a really good thing to take to increase your milk supply. There's lots of lactation cookies around that have, those well-known lactagogues, we call them, in them. There's the blessed thistle, which is a standard, pretty standard thing that people might take to increase their milk supply. And making sure you have plenty of protein and lots, good fluids, not getting dehydrated, because even at this time, breastfeeding can dehydrate you and make you feel really yuck. So that was blessed thistle are the tablets, fenugreek seeds, just chewing on them. Teas have fenugreek in them, and cookies, and the savoury, or they call it savoury or nutritional yeast. It tastes like Vegemite and Marmite, and it's flaky. Have you ever eaten it?
Yes, I have.
Yes, and it tastes like Vegemite and Marmite, and you can put it on eggs or in everything. So that's very good for you. And I think it's, people used to say, Guinness is good for babies and all that. I think it's just the malt and the yeast, which I think women find it helpful to increase their supply. Yes.
Okay, great. Thank you for that. Just going through some more questions here. Trelisa said, if baby is fussy, so pulling off, jerky movements, funny little grunts, but the mouth's wide open like a fish and still going for the breast, does this mean that they're full, or does this mean they need to be burped, or not getting enough or too much? So she's just wanting a little bit of advice on what that might mean.
And that does depend on what age the baby is. It sounds like this baby might be about 4 weeks. I'm not sure. But I would, and it depends on the time of the day, but if it's at evening time, I would be offering the baby, I'd be offering the baby the breast every hour and a half or 2 hours. And if you can, pop them down in a bouncer or something so their gut gets a bit of a rest, if you can, for as long as you can, or move them around, do something with them, try and space it out a bit, and not and then let the baby go back on the breast. I'm thinking if it's an evening thing, I would be and not sit there and wonder, not sit there and worry and think, I haven't got enough milk, or I don't know what it is. If you just sit there and try and relax and just gently, don't force baby onto the breast. They don't like it, and just gently leave them there to just put themselves on, bring them on gently. Because they can feel the tension and the frustration, and when parents want to go out and hurry and they want to quickly feed a baby, the babies can feel it, and that's why you never get out on time. They always, something happens, they don't want to feed or something like that. They pick it up all the time, don't they?
I remember that. If they were like being fussy and then I got more agitated, we'd never win, because they'd never, it just was a bad combination. Which I can see now. At the time I didn't quite understand, but I can, looking back at it, I can see that now. So now we've had more about Spilly babies, so spitting up frequently. Generally it's just liquid. So again, just to reconfirm it, it's kind of like they're wanting to know if it's a sign of reflux, and when it might be a sign of reflux, or
a sign of reflux, because babies, they do reflux up their milk, but reflux is when it's really uncomfortable for the baby and they've got really bad indigestion, and that is the acid coming up. And you'd know, if a baby just spills all the time, I've said that's okay, but it is worrying. But those babies usually put on good amounts of weight too. A refluxy baby is very uncomfortable. They're unhappy. They definitely want to be up for a good amount of time after they're fed, which sort of stretches out things. You could go, people say their baby's refluxy when sometimes it's just the gut maturing, but there is medications that people can take, and in fact there is a question about medication for reflux, isn't there? Is there a question? Was there a question about that? Sorry.
No, that's okay. Sorry. No, I haven't seen one with his medication.
Unless the baby's unhappy, I wouldn't be worried about it.
Okay, perfect.
Yeah, I really wouldn't.
Great. That's good. Kelsey's asked, is how to help with a baby with a feeding aversion, and is there anything you can do to prevent a feeding aversion with the next baby? There's no more details around that. Yeah,
feeding aversion happens for different reasons. Sometimes sometimes the babies, the mum may have started a supplement, something's changed, the milk may have changed, they may have changed their deodorant and the baby doesn't like the smell of a deodorant. We call them strikes and aversions and things like that. We use garlic. We get the mum to eat lots of garlic, and that changes the taste of the milk, and it might make them want to go back on the breast. And it's said that her first baby had a feeding aversion. I don't know what it is, and it might, she might unbeknown may have, her supply might have dropped for some unknown reason. I'm just not sure, but I would definitely tell your midwife, if it was in the first 6 weeks or something like that, that's definitely something you would tell your midwife. Or make sure that you go to Plunkett, and Plunkett will be open again. But when you have this next baby, around the same time that you first had their aversion, I'd go and speak to someone at Plunkett, because there's Caesarean nurses and lactation consultants there that would give you some good pointers of what to look out that it was going to happen. But I wonder if you think back, if you got sick, or I wonder what it might be. Sometimes, babies, if she was still breastfeeding and got pregnant, sometimes that babies wean themselves. If you're feeding them, I'm unsure. I need a bit more information.
Yeah, no, I think that's still
something the mum
really
changed.
Helpful. Yeah. Okay, great. So I think we'll move on to the next kind of topic now, just given the time. And there's been, as I said, there's been a lot of questions coming through online, and we've still got a lot of questions, and hopefully we're covering a broad, like there's lots of specific questions, but a lot of them I think have been covered by what you've talked about in general. If not, as I said, Andrina, our sleep coach and midwife, will be on and she'll be able to come back to you in the next, tonight or tomorrow. So so I just wanted to quickly talk about pumping, because it is quite a topic that does come up, like to pump or not to pump, or when you might need to pump. So I was wondering, can you start by giving us a bit of an overview of what you might need to use a pump during the breastfeeding journey, like why someone might need a pump?
I don't feel that, but I know that women want to be really prepared, and quite often they want to buy a pump before they have their baby. It isn't a necessary thing that you need, unless there's very specific things, like you knew you were having to go, you had no choice and you were having to go back to work, but early, and you wanted to continue breastfeeding your baby. That is one very good reason to get a pump. If you had some social engagement, you had to be at a wedding or something like that, people nowadays often get their mothers or someone to bring the baby to the thing, and they end up not needing to pump. But we often, if a baby appears to not be putting on weight at the beginning, we might suggest that you use a pump for a couple of weeks to increase your supply, for several reasons. to give you milk to come out to feed back to the baby, and also to lift the volume that you produce at the time. So we get women to do that. Often women coming out of the neonatal intensive care or the SCIBU are expressing to keep the milk supply up for baby. Women sometimes want to reach for the pump in those early days when the milk is coming and they're engorged. And sometimes expressing or pumping increases the problem. And we say to try and do it naturally and just get the baby to go on and express, feed, so that sort of releases the pressure of the milk. But if you have to express for comfort, if you really, really are overfull, we just say take off 10 or 20 mils, not big amounts, because you can overdo it. I had a woman the other day who was expressing all the time, and she just got out of control, and she had a huge oversupply, which brings other problems, because she just started when she possibly didn't need to, and didn't know what to do and didn't know how to stop. But I've already talked about tonight, instead of using a pump or borrowing a pump, if you are engorged and you're having a trouble getting the baby on, remember to do that reverse pressure thing to try and soften around the nipple, so that it will soften and baby can get on. And once they start taking as much as they need, your breasts will stop overproducing.
Great. So on the topic of breast pumps, we've just got a few questions. So Frederick's asked, what does it mean by a breast pump being hospital grade, and does it really make a difference? Or
it depends. I think she needs to,
she's currently almost exclusively pumping as we try to establish breastfeeding with a good supply.
There's a hospital grade pump. I don't think anybody probably needs, but this woman is expressing all the time. That's what she's exclusively doing. The hospital grade pumps have super strong motors, and we had a small discussion, didn't we? It's got a closed circuit. I don't think there's any need for anybody to have one as such, unless for specific reasons. I think the ones that are on the market at the moment, like the top end ones, like the Medela, I'm not sure, Medela is a pretty good one, and they do a swing, and they also have done one that's a bit more, they're $400 or $500. There's also the Unimom, which is the pink one. Both those pumps are very good pumps, and they would be something that I would look towards buying if you were expressing every 3 or 4 hours. They would do the job.
Great. Okay. Perfect. And yes, as Casey's asked, which we've kind of touched on, is pumping necessary in the first few weeks, or does it depend on if baby is gaining weight or not?
We like to. It's really. It's just good to leave it all happen naturally, Casey. And unless you're told that you need to pump, I would not bother. It's a lot of mucking about. But I know when people have got pumps and they get to about 2 or 3 weeks, they want to know how it works and all that sort of thing. But unless it's needed, I wouldn't bother. It does confuse people. And I tell you what sometimes happens is, often when we're getting women to express and then top the baby up, they start not trusting their bodies, and they like to see the volume in bottles, and they really start doubting their supply and how much the baby's getting, and it really interferes with the whole baby knowing how much to take. So I wouldn't do it unless you had to.
Okay, great. Becca is using Haka, using a Haka on the non-feeding side. Is that reducing the available milk for her baby when she switches sides, or does it just catch what would otherwise be lost to a pad? I'm not wanting to use the Haka if he's feeding off both sides during one session, but maybe it's okay to do it.
No, I wouldn't be using I would encourage using a Haka on the other side. Well, if you're going to feed on both sides, I think yes, it would take some of the volume off. If a woman is I sometimes suggest it to women, if they start one side feeding and leaving this breast until the next time there is a build-up of milk, I get them to take the letdown off, but not if you're not feeding both sides.
Okay, great. As your baby starts to sleep for longer stretches at night, what are the considerations or advice around pumping in the night or letting your milk supply decrease, and also letting mum sleep longer too?
Yes, I think if your baby is naturally going to stretch out at night, and I'm hoping that continues for a wee while, I think that your breasts really do they adjust. As I said before, maybe taking off a little bit before you go to bed might ease with the fullness, later on in the morning. But if it's only like a 5-hour gap, then your breasts have just learned to adjust to that. They might be super full at that next feed, but they just adjust their production.
Okay, great. And then we've got the questions around the colostrum, which we talked about at the very, very beginning. So just in case people have just joined us and stuff, we've had a couple of women who've asked us for advice on how to harvest colostrum before baby comes, which would be really, really helpful. And again, she's having a C-section shortly. So we're wanting to know how to do that and for how long.
I'll get this lovely breast out again. And harvesting colostrum we do from about 36 weeks, and we do it if we think you're having a caesarean. It's a kind of okay thing to do if you need to have your baby early, or if you have diabetes. And so I can't think of any other reason why you do it. We have the packs. Midwives can get their hands on packs. We have these these are 1 ml syringes. That's only 1 ml. But when you first start expressing colostrum, you probably only get about that much, to be honest. So women might use this syringe a couple of times and build up until it's nearly full, and then you would put a little lid on it, or you don't have to. You might just put it back in here. Draw the bung down and put it in the freezer like that.
Okay.
Yeah, just put it in the freezer like that. So we get women you can do it either way. You could get a very clean teaspoon and you just gently push down behind the areola. That's the nipple at the top, and this part here is the areola, and you push in and wait till a few little droplets come. And if you're used to doing this but you'd only be a medical person, you can suck it up very slowly with the syringe, or collect it on a spoon and then suck it up with the syringe and put it in and keep it clean and bring it to the hospital when you need to come. But we often have packs made up from the hospital, and this is like obviously a specimen bag, but this is a very clean thing to be putting everything in, and you just bring that in frozen to the hospital, and by the time you need it, it'll be 3 or 4 hours later. It would have thawed, and we'd give it to the baby, as well as putting baby on the breast once baby's born.
Great, thanks for that. That's really helpful.
Gives them a really good start.
That. No, that's really, really helpful. I've got Emma has asked, is there a way to express milk for the freezer that doesn't increase or affect your supply, and when would you express? I don't want my supply to increase, but I want spare milk in the freezer if I need to go out with baby.
Okay.
Go out without baby, sorry.
Yeah. So I get asked this all the time, and I think the most sensible time, if you're going to express to get a bit of a stash in the freezer, would be to do it first thing in the morning when you tend to wake and you're a bit overfull. I would just take 50 mils off at a time. That's sort of known to not really increase your supply too much. So 50 mils at a time, 2 lots of that's nearly a full feed for a baby. So if it's just in case, I think that's enough per time. And you could do that. You could do that with a haka. Just get the let down. I don't know which way she's feeding, but you could do it with a haka and not actually really express. Yeah.
Okay, great. Thank you. Well, that's kind of like all the feed kind of questions. We'll just quickly go on talk about mum's well-being and looking after yourself. Just a little bit. We'll just touch on that. We've got a few questions on that. What would you say to mums about looking after themselves while breastfeeding, and mental health, what they should be aware of, anything to watch out for, that sort of thing?
Well, it's breastfeeding, and especially for the first time, the whole birth and bringing bringing a baby home and being responsible for it and learning all these new skills is incredibly intense and can be very emotional for some women. You might have placed great expectations on yourself because you want to be a super mum. You may have had a very responsible job that you looked after a lot of people, and you feel like that you're going to be, that you're going to have to be really organised with this baby. And you might not have the delivery that you wanted. It might be quite a surprise what happened, and these sort of things really impact on you when you go home. And you've got to cut yourself some slack. It's important. I think that it's important to try and not be on social media for those first couple of days, and try and not be that, if it's really been a great shock to you, and you're a bit sore, you might have had a caesarean section. I want you to give yourself some time to just get to know your baby and to bond with baby and get your partner. I'm hoping you'll have a partner there to support you at home, and that, get them and communicate with them what your needs are. And sleeping is disturbed when you first come home with your baby. Some of us cope with lack of sleep and some of us don't. I didn't ever cope with lack of sleep. I got quite nasty and with a bit of a grouch. So I knew when I came home from the hospital that I didn't expect to take my babies out, and I had big sleep-ins in the morning, and I had an afternoon sleep in the afternoon. And I really needed that. So you've got to really look after yourself, eat well, sleep when you can, get everybody to do everything for you, the vacuuming, the washing, get your partners on board to do that. They will really want something to support you with, to support you by, and that's the best thing that they can do is to do any of that. And, visitors will want to come, and I think women are quite lucky at the moment as they don't have an influx. For there's good and bad things, and the no influx of visitors is quite good, because that puts pressure on you to put your face on and have the house clean. Maybe you really want to look like you're doing a really good job and have the house clean. It's not really that. The importance is getting your milk supply going, loving this baby, enjoying the moment with your support person, and just going nice and quiet, and your postnatal time will be a lot easier, I think. If you're feeling like, and if you've struggled with low moods or been treated for depression before, it's really super important to tell whoever's looking after you for those 6 weeks, so that we can look for signs that it's something more than just mum being tired and tearful. And so the sleep thing is if you're not able to go back to sleep when you get up and feed baby in the night, and if you're lying there worrying about the next feed, or what if the baby doesn't want to feed properly, all those things, that's a sign that you need to tell your partner that you're very that you're worried, and that you're not enjoying this new job that you got, because that is a new job. And speak to somebody about it. But it's fair to say people have moved away from their support. In times now people are locked down and they don't have people around them. That's a real negative to it. And if you're used to running a company or just being super efficient, you need to pull back from that, because this is not what this time's going to be. Your baby's going to wake when you don't want it to feed. You might be struggling with sore nipples, oversupply, undersupply. It's incredibly overwhelming, and you've got to really, really relax if you can, and just try and go slow and look after yourself, and allow people to look after you.
That's really good advice.
You and to drop your food at the front door. And for partners, they need to, the guys, you might need your partner to get up with you when you feed in the night, and then they might have to go back to work. And if they're still doing that and having to concentrate at work, sleep, both having a sleep on the weekend is a really good idea, and put signs on the door and say, blame the baby for everything. Say the baby had a rough night and they need to sleep. Just don't ring, turn your phones off. Turn the phone off and on silent. This is your time, and you won't get it back. And if you don't do it well and look after yourself, it won't be very enjoyable.
That's really good advice. Just still on that whole mum wellbeing stuff, do you have any tips on reducing the chances of getting mastitis?
Yes, a few. Introduce going long periods without a breastfeed, and I know we've talked about this about the baby starting. Your body will adjust to that, but trying to go long periods if and not feeding or not emptying your breast properly is a real thing for building up milk and getting blocked ducts and mastitis setting in. You can get mastitis from very damaged nipples. A bug can get in there and cause that as well, but everything would be very uncomfortable. It's the regular emptying of the breast which is going to stop you getting mastitis. But once people get a bit more active, and perhaps they go away for a holiday, they travel around and see people and showing their baby, that's a classic time for people to actually get mastitis, because they're doing half a feed here and half a feed somewhere else, babies in the car. Just emptying your breast fully is the best advice I can give you.
Okay, great. I've had another one from an online live saying Michelle has said, "Hey ladies, my third child is now 3 months old, and after failing to breastfeed my previous 2 kids, I'm determined to succeed this time. In 2019, she was diagnosed with sorry if I don't get this right, but duct ectasia?
Okay.
ECTASIA. I don't know if you
know is it
that.
DUCT,
duct. While I don't have mastitis, I do have painful lumps despite pumping, massaging and using warm compress, and very painful letdowns. Any tips to reduce pain and break up these ducts?
Yes, and the ducts, you're doing all the right things. You're doing all the right things for this. Blocked ducts. Yes, if you increase your intake of lecithin, which is in a lot of foods, like people put it in lactation cookies and things like that, but you can actually take lecithin tablets to thin your milk out a bit and maybe make everything empty a lot better. People getting recurrent mastitis or blocked ducts, it's a really good idea for a couple of weeks to take lecithin. And I have something that I've written. I wrote something about lecithin, but just if you go to a health food shop and ask them and say, I want to take lecithin, that should help decrease the chances of it, and it makes them your milk might be just slightly fatty and cloggy, and this helps. That's a practical thing you can do.
Great.
Feeding the baby in lots of different positions to try and get each duct. You're obviously doing all the right things.
But
lecithin might do it.
Someone's wanting to know any advice on nutrition, certain foods that can affect baby through breast milk. I think we talked a little bit about increasing supply, but if there's I don't encourage women to stop to withdraw anything from their diet. If they're going to do it, I like them to have guidance by somebody like a naturopath or somebody, and there's a great practice, but it's in Mount Eden, called Motherwell, and they're really good with babies' tummies and things like that. If you have a family history, or your partner has a family history of some sort of intolerance to food, well, I would think about that. If your baby was said to be super colicky or something like that, milk, dairy, having too much dairy is a common thing that people will suggest that you try and cut out for wind, and it often helps, and it's easy enough these days. There's so many choices of what to substitute dairy with.
I learnt recently that Plunkett were telling people that avocados can make a baby's tummy more unsettled, which is quite interesting because it's usually around that time that people are saying, I don't know why my baby's unsettled. I think you just need to have a good balanced diet unless it's very obvious. I don't think you should, if the season for mandarins comes in and you have a whole big bag of mandarins, it's going to give you a sore tummy, and it can often go through and do the same for baby. There's lots of wives' tales about lettuce and garlic and all those sorts of things. I think it's important to not just willy-nilly stop things from your diet. Dairy's a big one, but if there's a family history of asthma and eczema, I might choose to do that.
Yeah. Cool.
I often think a bit of coffee, too much good coffees and chocolate together. I think the cocoa bean might upset it. If we had a lot of coffee and ate a lot of good chocolate, it'd probably give us a sore tummy and we'd need to go to the toilet, and I think it might do the same for babies. Not much else. Yeah, it's a really hard one. Yeah, it's a really hard one.
That's all right. Well, I think we might wrap up a little bit, Libby. It's been really, really helpful. We've covered it. We've been talking for quite a while now. So we will definitely get to any questions that we haven't got to anyway. And Raynaud will be online. We'll definitely be helping you out with any questions.
That's lovely. You've got that.
Definitely follow Libby's social channels. She's tagged in all our posts. I just want to thank Libby so much for joining us and for offering the support to all the mums out there, the new mums. And everyone stay safe in your bubbles.
Yes. And I hope everybody does well and enjoys their baby. Thanks for the opportunity. Thanks, Amelia.
No worries. Thank you.
Right. Thank you.